Hello and welcome to Health 2020. I'm Dr. Sello Mutau. By the end of this show, 2 to 3 people will have died of a heart attack in South Africa. Now, globally, heart diseases kills more than 17 million people every year. This is more than HIV, TB, malaria, and COVID-19 put together. Cardiovascular disease is the leading cause of death in South Africa after HIV and AIDS, and more South Africans die of cardiovascular disease than all of the cancers combined. The good news, though, is that up to 80% of heart disease before the age of 70 years can be prevented. Today, we have a heart specialist in studio who will help us understand all about heart attacks and how they can be prevented. Now, Joan Nekumbe considers herself very lucky to have survived a heart attack. She shares her experience with us.
The day ngiba ne-heart attack ngavuka ekuseni ngahamba ngageza ne mangiqeda ukugeza ngaprepare ngahamba ngaya emsebenzini. Then mangifika emsebenzini I started to have pains, chest pain. Then ngitshela i-colleague yami yazi I'm not feeling well. Wathi kimi thola ama-Panado. Then I tried Panados, they couldn't help. I tried a lot of things, they couldn't help. But I keep on getting chest pain. I was blocked, I couldn't breathe. And then towards lunch, and then it became worse. Then ngahluleka ukuphefumula, and I was like wheezing all the time, wheezing, and then I remember ngihluleka, and then bengithi ngiyadla bengasakhoni nokudla, then ngacollapse again. Then they call the ambulance emsebenzini. I remember about doctor maseng papa magebe ngitshela ukuthi you had a heart attack. Bangibuza ukuthi is there anyone in your family with a history of heart attack? Then that's ngatshela ukuthi my mom died of a heart attack and my sister as well. After usiswa meshona, I had to find out the information because I was so concerned. She died in my hands because I was trying to help her. Because heart attack is a silent killer. It's something that you wouldn't know, Uguti, I've got a heart attack, until you get it, you know. Like my sister agakulanga, suddenly nje uvele wavuka ekuseni naye, she was preparing to go to work and then she complained of chest pain, then she collapsed and then she died. The timing ngibuya esibhedlele abantwana bami bebekhala ukuthi umama uzoshona sishiye, so sihlupheka, so hlala nobani. Nasemsebenzini ama-colleague, they were so concerned each and every time bazongibuza, you didn't forget to take your medication, are you taking your medication? It's like everybody was so concerned ngami nempilo yami. The time ngiba ne-heart attack azange ngicabanga ukuthi ngaba kuyinhliziyo, because into ebekade ngingayicabangeli leyo ukuthi ngaba nayo. Bengicabanga ukuthi mhlambe it's a asthma attack njengomuntu one-asthma, but kwase ngizofind out ake sengisesibhedlela ukuthi no, akusi asthma, it's a heart problem. I was just living a normal life. But after when I was admitted and I get out of hospital, my lifestyle changed in a way yoguti. I started to go to the gym, eating healthy, looking after myself. Ngifila lucky kakhulu ukuthi mina ngisurvivile i-heart attack. Ngoba abantu abaningi bayashona ngayo le i-heart attack ngoba njengoba ngisho ukuthi i-heart attack it's a silent killer. Ngeke ukwazi ukuthi unaso lesifo until it attack.
All right, so to enlighten us a little more about heart attacks is our special guest, Dr. Ngoba Tabedza, who's the academic head of cardiology at Wits University. Dr. Tabedza, welcome to Health Talk.
Thank you for having me, Sino.
All right, and thank you so much for your time. Perhaps before we start talking about, heart attacks, let's just understand what a normal heart does.
Yes, Silo. So a heart is a muscle that really is the engine of the body. And its role is to pump blood and to circulate it to all the organs of the body, the brain, the liver, the kidney, etc. We can't control it. It beats autonomously. And in this blood is oxygen and nutrients that are important. For the heart to keep functioning, it also needs its own blood supply, and that's through the coronary arteries. And that's what happens when you are diseased and one is at risk of having heart attacks.
Mm-hmm. So perhaps let's then, extend it from there. What then is a heart attack and what actually happens when one has a heart attack?
So a heart attack is an entity whereby the blood vessels that give blood supply to the heart have been blocked. And this blockage starts off over time a small, and a patient would complain of angina or the chest pains on exertion. And then ultimately, when it now completely blocks, you then have what people call as a heart attack.
So what actually happens is, are you saying that that part of the muscle actually dies?
Yes. So the blood supply that gives blood to the heart itself gets occluded, and then the muscle itself gets necrosed, and it's no longer able to function. So the heart can't pump anymore the way it previously did.
Okay. So what is then the outcome? I mean, obviously, you hear of people that survive a heart attack, some don't. Does it depend on the area or the amount that's affected?
Yes. So if you have a big heart attack, so if a major artery gets blocked, usually one of the major 3 arteries that give blood supply to the heart get blocked. If that doesn't get restored in terms of blood flow, you can actually die instantly.
Right.
But if you take medication in time, we can abort and prevent injury to the heart.
Right.
And that person can actually survive a heart attack.
Let's talk about symptoms then. I mean, you know, I suppose someone would say, how do I know if I'm having a heart attack?
So like I indicated, initially it starts with you having this central crushing chest pain. So it's not a sharp pain, and it's associated with feeling nauseous, you sweat a lot, and as the pain gets extensive, it then extends to the left arm, to the left side of your neck, and there's a sense of impending death. And that's when one knows that this pain is not heartburn, or it's not something that I eat and that's just upset my stomach or system, but there's something wrong with me and I need to consult.
All right. So let's get back to perhaps the most important question, to say, you know, we know what causes it. As you said, you know, the blood vessels, you know, getting blocked, as it were. But who's at risk of developing a heart attack?
Yeah. So it's all about lifestyle. And also with increasing age, one gets at increased risk of complicating with a heart attack. So there are certain risk factors that people have. We have those that we can modify and those that we can't modify. Those that we can modify are things such as hypertension, smoking, if you are diabetic and poorly controlled, if you have cholesterol problems. And often, for example, in our Afrikaner community, there's a high prevalence of a genetic cholesterol problem. So all of these risk factors put you at risk to blockage of these blood vessels that give blood supply to the heart. And it accelerates that process. So one needs to basically control these risk factors to prevent one from complicating with a heart attack.
Yeah, we heard in the insert, you know, Joan said, look, my sister, you know, she was asked whether or not she's had any family history of heart attacks. How significant is that?
Very significant, Silo. So it definitely runs in the family. There are some risk factors, as I indicated, like the cholesterol risk factor, the high blood pressure risk factor. All of these things tend to conglomerate in families. So if you know that your mother or your father or your grandparents or a sibling has died from a heart attack, you are probably at risk. And whatever risk factor they had, if they are on cholesterol tablets, they're on diabetes tablets, it means you too need to check to make sure that you don't have that condition. Let's
go back to those lifestyle issues that you mentioned. Which are the most important risk factors there in terms of lifestyle?
Lifestyle, definitely. Lack of exercise. What you eat is what makes you. So if you are eating a lot of high fatty content foods, high animal fat-based foods, and less plant-based foods, you're putting yourself at risk. So also, and importantly, in Johannesburg, in urban areas, a lot of stress. We're always rushing to do the next, reach the next target. A lot of stress and lack of sleep. These are all important risk factors that we can change the way we live in order to give ourselves a chance to live.
Right. About changing that, the way we live, I think we'll try and address that after a quick commercial break. When we come back, we continue our discussions on heart attacks and, of course, answer your pressing questions on heart attacks. Please stay with us. So welcome back. We're still talking about heart attacks. And here's what some of you asked about heart attacks.
What is it that I need to do to prevent myself from having a heart attack?
The question I want to ask about a heart attack is what are the symptoms that may cause a heart attack?
I just want to know what causes heart attack.
All right, so let's get a response from our expert. I mean, some of them would have covered, but I think I like the very first one. to say, what can I do to prevent myself from getting a heart attack?
Yeah, so that's a very important question, Silo. And everyone needs to know where they stand. I think that's one thing about prevention, is to know where you stand. We've talked about the risk factors, the ones we can modify. Stop smoking, know your blood pressure, get it controlled. If you're diabetic, have your diabetes well controlled. If you have cholesterol, be on cholesterol tablets. But all of these things are happening in your body, and you don't know about them. You don't have a symptom or pain or a cough, for example, unless you go and check. And that's as our first interviewee patient showed, that heart attacks are a silent killer. So that's what I would recommend. Get checked, know your numbers, and then be serious about it. Take responsibility and adhere to good living standards.
We'll be discussing obesity quite soon. What's the link between obesity and a heart attack?
So definitely obesity also comes in because it's a conglomeration of all of these things, what we call metabolic syndrome. So someone who is obese generally will have high blood pressure, cholesterol problem, and they're most likely to complicate with diabetes.
Right.
So all of these things are existing in this one individual. So it's just all the negative risk factors together, and together they just increase the risk of stroke, heart attack, and other complications.
All right. Let's see if there's questions that have come through over the week. The first one from Levasin says, what is angina and how do I know if I have it?
So,
and I think we have another one from Khomotoya says, how do I know if I'm having a heart attack?
okay, excellent questions. As I indicated, angina is a type of chest pain that you get. It's a chest pain caused by blockage or poor blood flow in the blood vessels that give blood supply to the heart.
Right.
You're going to get the central crushing chest pain, and in its severe form, it radiates to the left arm, the left neck, and you feel nauseous and you start sweating. And that's when you now know, I'm having a heart attack. So this pain will persist. It won't just come and go.
Right.
When it stays there, you need to immediately take an aspirin and chew on it and go and consult and see a physician.
Right. Okay. Let's see if there's other questions. Sarah from Port Elizabeth says, my father died when he was 40 years old from a heart attack. He was slender, but he smoked. How can I safeguard myself against suffering from his fate? Another interesting question there.
Yeah.
Very important one, in fact.
Excellent question from Sarah. Again, a common misnomer that we think heart attacks only affect people who are overweight or obese. That is not true. Even people who are slender, their blood vessels are sick. So think about it as more of a vascular health or vascular well-being. So if you're smoking, you will increase the risk of you having a heart attack, like Sarah's father. So what Sarah needs to do is definitely avoid smoking, and also go and check if she has the other risk factors that we've been talking about, such as hypertension, bad cholesterol levels as well.
All right, great. Let's see if there's more that has come through. Yes, Willand, I think it is, yeah? Is it true that if you're having a heart attack that you must cough because coughing forces your heart to pump? Any truth in that?
Yeah, so Willand is really talking about what many people think of.
Yeah.
But as I've indicated, heart attacks are vascular problems, so it's blood supply to the heart that is being occluded.
Right.
So that needs to be restored. So coughing is an airway thing. It improves circulation in the air. So if you're choking, you cough, and your choking gets relieved.
Right.
But in a heart attack, what you need to do is help the blood circulation to be restored. And the best way to do that is to take an aspirin or a dispirin and chew on that, and that's what's going to improve the circulation.
Right. The next one, I believe, is a voice note from Mark.
Hi, my name is Mark. I have been having pains in my chest for a while now, and I do not want to go to the doctor's rooms because I am afraid of contracting the coronavirus. What should I do?
Interesting one. And we also have Jabu from Foslores asking, am I at higher risk for COVID-19 if I have had a heart attack? Two very interesting ones there. I mean, talking to the link, or the impact of COVID-19 on heart attacks. Perhaps you want to just take us through that? Yeah.
Yes, so this is a very a key observation that we noted. During the peak of COVID-19, a lot of patients who suffer from cardiovascular disease actually stayed away from health facilities out of fear that they would be at risk of contracting COVID-19. And what we've also learned now that the pandemic has quite matured is that people with cardiovascular disease are affected more severely. So they are more likely to end up being in ICU and some of them even dying. And especially if they are not taking their medication. So we've seen that the medication helps to control their cardiovascular disease, such as hypertension, heart failure, heart attacks, or ischemic heart disease. And we recommend that they continue. So for Mark, I would recommend that he does go see the doctor, because just as much as he's at risk of COVID-19, he cannot treat his heart attack or his symptoms at home. They need to be investigated. The diagnosis needs to be confirmed if he's having a heart attack or angina, and he needs to be started on the right treatment.
Yeah. But the question around risk, though, they're not necessarily at higher risk of being infected, isn't that so?
Definitely. So the risk is the same
Right.
in terms of getting infection from COVID-19.
Right.
But it's just that if they do get COVID-19, they have a severe course of disease compared to someone who does not have these conditions.
Great stuff. And let's see if there's more. Yes, Marianne from Tanis. Is it possible to live a long life after having had a heart attack? And if so, how? That's a brilliant question.
Yeah, this really is a question for the whole nation.
Right.
And it highlights the need to change your way of living. And often people only do so after a heart attack, as she's indicated. So it is possible to have a normal life and have a good prognosis after having a heart attack, as long as you change and address these risk factors. And it's a personal thing, it's a personal journey, but if you do that, you can harvest the benefits.
Right. Well, let's talk about exactly how. I mean, I know that we may have touched on it, but if we need to repeat that, I think it's still fine, because it's important.
So the first thing I would talk about is diet, whereby one needs to avoid, especially animal-based fats, which so a lot of red meat or processed meat content one needs to cut down, preferably fish or fowl, bird or chicken-based meats are more better than red meats in terms of food content. A lot of vegetables, a lot of fiber, a lot of fruits are also advantageous. In terms of exercise, if you know you don't walk, you hardly walk, you drive to work, you sit in an office, you come back home, you watch TV, you go to sleep, that routine needs to stop. The body was designed to exercise, so at least 3 to 4 times per week of 30 minutes of exercise that generates a sweat. It could be walking, it could be cycling, anything that you enjoy. Then importantly, the silent risk factors, you need to have those checked. Your blood pressure, your cholesterol, diabetes, and especially if you have a family history. So someone in your family has suffered from a heart attack, you need to make sure that you identify what is the risk factor in the family that puts us at risk, so that you can also control that.
Right. And it's anybody, any age, isn't that so?
Any age, but importantly, as you get older. So I'll definitely say 35, 40 plus, you must. Every year, make sure you do go for a health screen for these numbers, your high blood pressure, cholesterol, etc. But we also now see people as young as in their 20s complicating with heart attacks. And this is because of the way we have now urbanized and westernized how we live on fast foods, and we no more have the essential fibers and fruits that we need in our body.
All right. Dr. Tsebeza, this has been a fascinating discussion with you. Thank you so much for your insight, and till we chat again. Right, time for a quick break, and after the break we summarize the most important messages from today's show. Welcome back, and thank you so much for staying with us. Here are those key messages that we promised you earlier. Firstly, we know that about heart disease, 80% of heart disease before the age of 70 can be prevented. And you can prevent this by living a healthy lifestyle, as we said. So what is this healthy lifestyle? Well, eat whole foods, as you heard, exercise regularly, maintain a healthy weight, don't smoke, please. Reduce alcohol and limit, stress levels. And as we've gone through signs of a heart attack, you'll feel some chest discomfort, pressure, or pain. And this pain can also be in the arm, shoulder, jaw, or back, and it can feel, anxious as well. You have shortness of breath sometimes. You can feel dizzy or lightheaded. Sometimes you can even have nausea and stomach ache. Now, please, this is very important. Don't ignore your heart symptoms. Get to your doctor or clinic as soon as possible. And here are these useful numbers that you should have. From your cell phone, you can dial 112 or dial 10177 to call an ambulance, or if all else fails, the national emergency number 10111. Well, that brings us to the end of this very, very important show on heart attacks. And thank you so much for watching, and thank you for sending us your questions and voice notes. So now next week, we're discussing obesity. Now, if you have any questions on obesity, please send them via SMS, WhatsApp, Twitter, Instagram, Facebook, as displayed on your screen right now. And until next week, well, as you say, please, sarang hantla and do take care.